protects the skin, but their melanin is in some ways, I don't want to say defective, but when that melanin hits by the sun, it sets off almost like a chain reaction. So a blonde Scandinavian or a blonde Irish person, the Irish person would be more susceptible to that. So you really need to know yourself. So what are we doing and what's coming down the road for prevention? This is a laser type of image of the skin, and actually I can see inside the skin beautifully here. These kind of images are like an ultrasound, but this is with a laser microscope. And you probably all know about biopsies and how we take biopsies and do surgery. But this is the future. This is what is going to make people like me and Dr. Rosenthal have a little bit of less burden of our work down the road, because we'll be able to see inside the skin and identify these cancers before we need to treat them. This is an example. It's a little wart. You can see it growing on the top, like those little things on the left there. So I'm going to try my best now to make you all good at identifying some of these early warning signs for skin cancer. There are three traditional presentations of skin cancer. The first is that of a little pink pearl that appears on the skin. People say, well, I never had a mole, but this one's a little bit pink and it's a new one. The second type is sort of a scaly sore that never heals. People might say, I shave, and when I'm shaving, I cut myself and it just keeps bleeding week after week. And the third type is the new black dot or the changing black dot. So this is an example of the pink